This is the bed making for this assignment. So I've asked Valerie for permission. She's going to hold her items while I change her bed. So my first step is I'm going to use some hand rub and apply PPE because I'm aware that the bed is soiled. So I'm going to the brakes. Move the bed away. And just lift up the bed, hip height at the lowest person, so sometimes you can work with two and put it there. Alright, and just put that in the linen basket that I've brought in. I've already prepared and brought the clothes in. Now, usually we'll then wipe down the bed. We use alcohol wipes and just, the bed is already clean. And then we make the bed. So to make the bed, open it out, ensure not to shake. Don't fold them quite. Alright. Just lift up the bed there. Place it in. PPE to be applied. Rub hands with alcohol gel. Make sure you wash your hands with soap after. Leaving the patient's room. Always seek permission. I usually like to, in the aged care facility, some of the ladies like to help make their own bed. Assistance. An activity. Enjoy. Just gonna straighten that out. Again, back to the hospital corner. Match that. Nice and tight. We're gonna make sure that you don't get any creases in the bed sheets. There's your hospital corner there. Creases in the bed sheets cause pressure injuries. So it's very important to make sure. I like to make sure it's not too long on one side and hanging. Patients can trip. It's coming through. Some patients like to use their own blankets and duvets. I always like to ask them, especially long-term patients or in an aged care facility. When cleaning, make sure you clean the handrails and remotes and things. Let the nurse call bells always available. Just by hand. There we go. Prepare by moving everything away. So again, put the bed back down now. Sometimes there's tags at the bottom to be able to tell. You can read the care plan for adjustable heights, but the safest option is right down to the ground, the lowest big prevention there. And then just put the bed back. Make sure that the brake's back on and it's closed. Again, after completing the bed, I'll wash my hands and remove PPE. Soiled or wet laundry can go into a red disposable bag, which is taken up to the laundry, or if just used, into the linen baskets.